Welcome, everybody, to Exploring Specialties in Medicine. This is our fourth and final session for this year. And welcome and thank you for joining us. I'll encourage you to follow our LinkedIn page. This is where we post all of our upcoming workshops, but importantly, also scholarships, internship opportunities, etc., research opportunities. And the YouTube channel is where you can find all of our past workshops. As a reminder, this is our third year of hosting Exploring Specialties in Medicine. So I encourage you to go back to our YouTube channel and find these sessions. You may identify some specialties that we didn't cover this year that we've covered in the past. And so you can go back and look at these on your own time. Our next workshop will be on STEM careers beyond MD and PhD. So these are all careers that do not require medical school or a PhD in, wet lab science specifically, but some of them are clinical positions. Some are based in the lab, and all of them typically require either a certificate, a master's program, or a different doctoral program other than a PhD or MD. So hopefully you can join for these two sessions on March 24th and 26th. Again, you can register for these from the LinkedIn page as well. So we'll jump right into our first speaker, Dr. Angel Byrd, and she'll be talking about her specialty in dermatology.
Hello, everyone. Can you hear me? Okay.
Yes.
Okay, awesome. So thank you, Dr. Miller, for inviting me. I'm so excited. Deepak was very instrumental in my time at Hopkins, so it's so surreal to be back here. So I'll just jump right in. Are you going to control the slides or do you want me to? Awesome. Okay. So I want to just tell each of you just congratulations. No matter where you are in your journey, I think you have to be able to just stop for a moment and just take it in. So congrats to you. I also want to just go through a few points, level setting with just the mindset perspective. I'm going to give you an overview of my journey, and then I'm going to end with some encouraging words because they always help me, and hopefully those words will help you embrace your journey. So in terms of a mindset, I feel like it's always important to just make sure that you acknowledge that the journey is going to be overwhelming. And so you have to reflect on the journey, celebrate the small wins, know that it's a privilege of reaching this milestone, whatever it is. Remember your reason why, surround yourself with positivity, and don't hesitate to ask for help early in the process. We covered this during our faculty retreat, and our chair, Dr. Janetta Coe, took us through this. And honestly, just the mindset is everything. So I want to encourage you guys to do that. In terms of my particular journey, I'm a Southern girl, born and raised in a small town called Edwards, Mississippi, but then we moved to the city, but the city is relative for Mississippi. But my family's now in the Jackson Ridgeland area. I attended Tougaloo College, and then I matriculated to Brown, where I did an MD PhD. Once I graduated from Brown, I then went to an ethnic skin fellowship at Hopkins under the direction of Dr. Janetta Coe. And then we were both recruited to Howard. So she was recruited, and then she recruited me along with her to now be on faculty here at Howard. So because of them, there is a me. And so when you think about that, you just have to reflect on all those people who are pouring into your life. And this is not even a fraction of the people that are pictured here, but it just reminds me along the journey how people really just poured into my life, which allowed me to be very, very successful. And for that, I'm forever grateful. Not to say that there weren't many challenges, many obstacles along the way, but there were also some very, very positive times as well. And so I reflect on those times throughout the journey to get me through, when the things got rough. And so we could talk about any of those. We have a question about, my journey from one institution to the other. We could talk about that as well. But this is an overview of it and how I was able to succeed in that particular aspect. Now, I'll put this in here because I felt like when I was in grad school, I felt that one of the challenges, one of the many, many, many challenges was that, for one, it felt like I was never going to graduate. And so I actually walked twice. I had the opportunity to decide if I wanted to walk first for my PhD and then again for my dual degree in the PhD. And I decided to walk twice. I'm like, I'm going to walk as many times as I can. I felt that I was never going to publish, but yet right before I got ready to graduate, I was able to publish in Journal of Immunology. And this is one of my first papers. This is the first paper of me publishing. So it's a paper I will forever, forever cherish. So if you like to think about immunology and the host response to fungal infections, please check this paper out. It's one of my babies. This is also another moment in life that I cherish because this was when I walked again in 2016, my MD PhD. And this picture says a lot because Dr. Reichner is here on my left, who was my PI in grad school. My then who was president at Tougaloo College, Dr. Hogan, my mom, me, and Dr. Richard McGinnis, may he rest in peace, played an instrumental role in mentoring me when I was at Tougaloo and making sure that I pursued the MD PhD through the early identification program at Tougaloo. Here you see Dr. Hogan hugging me when I actually got a presidential citation while I was still in school. So it's a moment, again, that I will forever remember. And I'm thankful for these people who supported me along the way. Okay, so what do I do every single day here at Howard University College of Medicine, Department of Dermatology? What have I done with these degrees that I've gotten? How do I put them to work every single day as associate professor and director of research here in Durham? And so I would be remiss if I didn't tell you about this disease that I have the abounding privilege to study day in and day out. Now, I will say that we study a lot of diseases in terms of those diseases that disproportionately affect skin of color, but hidradenitis suppurativa is the one that I study the most. For the sake of time, we want to get into the nitty gritty because I don't want to give you too much, but I want to give you just an inkling of what I do. It's a debilitating inflammatory skin disorder of the hair follicle, and most importantly, it predominantly affects African American females, and we do not know the why behind it. So it is my job to ask those challenging questions to understand the mechanisms that's leading to the pathophysiology that's then leading to the disease that we're seeing clinically. So this is what I technically do day to day, asking about the cells, asking about the proteins, asking about the genes, what actually is playing a role in this disease that we're seeing. So with that, I told you that I studied neutrophils in grad school, the normal host response. And so what I did was I said, well, how can I take what I know about what neutrophils do in our defense? And perhaps they're over responding in a disease like hidradenitis suppurativa. So I asked the very simple question, but a very complex question, are neutrophils dysregulated in HS? And we were actually able to go into this path of studying neutrophil extracellular tracts. And if those of you who haven't learned about NETs just yet, I'm sure they're in textbooks now and everything, but just a quick overview is an unusual novel cell death pathway. And basically the intracellular components of neutrophil homogenizes and is disgorged in the host defense. However, aberrant formation of these nets may play important roles in the pathogenesis of autoimmune and inflammatory diseases. And we think that this is what's going on in hidradenitis suppurativa. So with this is, I'm a visual person, so for teaching purposes, I just put this in here. If you remember that the neutrophil homogenizes and it disgorges its intracellular contents and the host defense, what it usually would do is engulf it if it was small enough, but it can't do that. And so if the pathogen is large, it homogenizes the intracellular contents and it disgorges it. And as you can see, it's disgorging it in the host defense to fight these pathogens. This is the process I think is over responding in hidradenitis suppurativa. So this is just a visualization of what I just said in words and what I just showed you in the still picture. I think this is one of the coolest pieces of data that I own to date from grad school, where you can actually see the neutrophils that are homogenizing and disgorging their intracellular components. And so this is the netting that I will allude to when I'm studying or when I'm giving talks and when I allude to it in the talk is here today as well. So the first thing we had to ask was, are these neutrophils in the hair follicles? And as you see, the normal hair follicle, you didn't see that much, there's not really much going on. But in the HS hair follicle, you see an exuberant amount of inflammatory cells. And I pointed out to you the neutrophils. So we knew that they were there, and published literature had already told us that they were there. What we did not know if they were forming these particular nets, and that we were able to show. So I told you back about 6 years ago, like this was in 2019, I pretty much worried, I would say. I was concerned. I try not to worry that I was never going to publish. And now, fast forward in 2019, not only did we publish, but we published in one of the top tier journals, the Science Translational Medicine, and we landed the cover of the journal. So it's just to show that if you just stay the course, if you keep the faith, you just keep going, it will happen. So this is just an example to all of you to just keep the course, keep the course. Okay, so I'll just end very quickly with just saying your life is a portrait that is being designed and painted every day. It's up to you to color it the color you want it. It needs to be vibrant in the midst of all of life's challenges and uncertainties. This is just something I want to motivate you to tell what keeps you going. I mean, what keeps you motivated to stay on this difficult path? And for me, my dad, I lost him when I was young, but I know he's smiling down on me. So it encouraged me every single day to work hard. I don't have kids. My mom is my baby. That's my pride and joy. And my spiritual growth is also very important to me. So this is what I've used to take me from HBCU to Glue to keep me grounded there to Brown. And now click one more time back to Howard. Exactly. So the next slide, I'm wrapping up now. This is just some of our Tougaloo colleagues, and I challenge you in the midst of it all. Life will happen, good things, bad things, uncertainties, disappointments, failures. It will happen. But please just prevail and keep it positive throughout the journey in the midst of it all. So I ask you, just click one more time, please. What color will you add to your portrait today? And always, always remember that even broken crayons color. And so I end with saying that because of them, there was a me, and because of me, hopefully I've encouraged you to embrace your journey. Always remember that we are always here to encourage one another, and it goes so many ways. You can click one more time for me, please. And you can see here a lot of my quotes that keeps me going every single day. But the one that I really like to keep in the forefront of my mind is the true meaning of life is to plant trees under whose shade you do not expect to sit. And so remember that as we're here to encourage each other along this journey. All right, for that, thank you so much. Congratulations, you got this. Stay thankful, grateful, and blessed. Keep a heart of gratitude. You can click 3 times. It's just something to remind you to stay thankful in the midst of this journey. And remember to always embrace your journey. Thank you. That's
Thank you
it.
so much, Dr. Byrd.
You're welcome.
We're going to move right along to Dr. Kavuri.
Hello, everyone. Can you all hear me?
Yes.
Okay, perfect. So good evening, everyone. Thank you for giving me this opportunity to talk about something that I'm really passionate about. I'm Bharathi Kavuri. I'm currently pursuing a fellowship in transfusion medicine in the Johns Hopkins University. So let's talk about this. Actually, let's do a show of hands. You can react or something. How many of you have heard of transfusion medicine as a discipline in medicine before this? You can react or shout out, anything works. Okay, one. Okay, I feel really proud about that. Cool, thank you. It's usually none whenever I give these talks. So, what does transfusion medicine mean? In simple terms, never heard of it. Yeah, you're about to learn a lot about it today. Yeah, so as transfusion medicine specialists, we basically make sure blood transfusions are safe and effective for patients who need them. We manage blood banks and keep hospitals stocked with these life-saving products. And we perform something called apheresis, which is a very fancy way of saying that we remove, filter, or replace blood components that need to be replaced. And in addition to that, we also work on futuristic stuff like CAR T cell therapy and stem cell transplant. So basically, we specialize in everything related to blood, transfusions, blood banking, apheresis, and these cutting edge therapies. And if you've ever donated blood or had surgery or even watched a medical drama, I don't know, House or Grey's Anatomy or anything, where someone shouts, oh, we need blood, stat, that's kind of my world. That's where we live, right? Someone working on hem-onc trials had no clue this was a specialty of medicine. Yeah, we exist and we are actually everywhere. We work with surgeons, hematologists, critical care teams, OBGYN colleagues, and researchers. A lot of us are researchers, and we are developing new therapies all the time, and we are omnipresent in the hospital, actually. So that is why I'm here to introduce you to transfusion medicine. It is one of the most underrated yet awesome medical specialties, in my opinion. I might be biased. Like I said, you may have never heard of it before, but by the end of this talk, hopefully you're thinking, wait, this kind of sounds cool. So before we go to the roadmap of transfusion medicine, I want to give you a little bit of overview of what I did. I'm an international medical graduate. I went to medical school in India and I moved to the US to do a residency in pathology. I fell in love with pathology when I was 18 years old. I read a book called The Final Diagnosis, in which the protagonist is actually a very eccentric old pathologist. But out of all the doctors in the book, surgeons, everyone included, I thought the pathologist was the most cool, and everybody seemed to go to him for answers. So I wanted to be a pathologist, and I applied for residency and got into pathology. And once I started my pathology residency, transfusion medicine was my second rotation. I don't know if any of you even know that transfusion medicine is a part of pathology, actually. I did a rotation in transfusion medicine and I fell in love with it, and it's happily ever after that. So that's my path. And here I am doing my transfusion medicine fellowship, and I will be starting a job come July. It feels like yesterday. But, a roadmap to transfusion medicine is, your typical pathway. One, you go to medical school. You guys can all make it. I believe in you. The second step is to complete a residency. So the unique thing about transfusion medicine is it's mostly pathologists who do transfusion medicine, as you can see, but you can also do internal medicine residency and do a transfusion fellowship. You can be a pediatrician and do a transfusion medicine fellowship. You can be an anesthesiologist even. Some programs will let you do a transfusion medicine fellowship. But I vote pathology, yes, biased. I think it's a really cool career path to choose. So pathology residency, for those of you who don't know, it's usually a 4-year residency. It's a combined track. Anatomical pathology and clinical pathology are the two core components of pathology, right? So majority of the people do APCP combined residency, and that's a 4-year track. I personally did a clinical pathology only residency. That was a 3-year track. So if you want to fast track your training and you're hyper focused on one of these subspecialties, and there are many, many in pathology, you can do either AP only or CP only. But like I said, 90% of the people do APCP. So once you complete a residency, ACGME accredited, you become board certified in APCP or CP. And like I said, I'm CP only. You can do transfusion medicine or any of the clinical pathology subspecialties with just CP only training. And for those of you who don't know, anatomical pathology deals mostly with tissue, like surgical pathology. Like if you get a biopsy, that's where the sample goes. If you've had a surgery and something gets removed, the surgical pathologists are the one looking at it. And if you've ever had like a fine needle aspiration or a pap smear or anything, that cytopathology also comes under anatomic pathology, right? And there's a lot more forensics, autopsy in AP. I don't want to go into the details of all of that, but CP is more lab medicine. We are usually lab directors and we deal with the lab test part of it. So once you become board certified, you can do a 1-year fellowship in transfusion medicine. You can even do 2 years. Some programs offer 2-year fellowships if you're interested in doing a research year. Then you become board certified in transfusion medicine. And the career paths after this are endless. You can go into academics, be an assistant professor of pathology in the division of transfusion medicine. You can go into private practice and practice with pathology groups. You can even go into the industry. There's a bunch of industry jobs in transfusion medicine. You can go into full-time research. You can work at a donor center with a lot of remote work opportunities. And you can even work with cell therapy, CAR T therapy, stem cell collections. So there's really so many options you can choose from. Just to, pull you all into TM, why should you consider it? It's a perfect mix of lab work and patient care. You're not stuck in one place. You're in the lab, you're at the bedside seeing patients. Sometimes I even have to run to the OR to talk to an anesthesiologist, and you can do as much research as you want. You have great work-life balance. I don't want to bias you towards any specialty or against anything, but we rarely get paged in the middle of the night. I will give that with a caveat. At Hopkins, we do have a lot of overnight procedures. I was here last night doing an emergent procedure, but most of the time we have predictable hours. And it's cutting edge. If you like science, tech, innovation, cellular therapy, I don't know how many of you have heard about CAR T therapy, but we basically collect patients cells, modify it to fight a specific type of cancer that they have and give it back to the patient. It's really like sci-fi, but in real life. And as I've shown, you have diverse career option. You can work in hospitals, research, industry, and you get to save lives in unique ways. You get to work with all sorts of patients. Trauma patients need blood, cancer patients need blood, transplant recipients need apheresis procedures, even newborns sometimes, they depend on the work that we do. We do have our downsides. It is a niche specialty. Evidently, most of you had never heard of it before. But that being said, I think that the job market with pathology has been really, really good of late. If you look at pathology outlines, they have a graph that shows the big uptick in jobs post-COVID for pathology in general and transfusion medicine in specific. And we are the one of the few paths of specialties that takes a good amount of call, but again, that's highly dependent on institution. Patient interaction with any pathology subspecialty is a problem because there is virtually none. But transfusion medicine is actually one of the only few paths of specialties that has a decent amount of patient interactions. I have seen 12 patients in my apheresis clinic today, but it's still considerably low. So if you're a people person, want to talk to patients every day, maybe you should think about it. I'd just like to end with this. I like to say that pathology in general and transfusion medicine in specific is one of the best kept secrets in medicine, but the secret's out now. You've all heard about it. So I encourage you all, when you get to med school, do an elective in pathology, go to the transfusion medicine division, go to the blood bank, and I assure you, you'll fall in love with it. Thank you.
Thank you so much. That was fantastic.
Thank you.
I learned a lot as well. So moving on to Dr. Brown.
Hi, can you hear me? Are you hearing me okay?
Yes, we can hear you.
Okay. So good evening. My name is Leanne Brown. I am a nephrology fellow here at Johns Hopkins. It's a pleasure to be here, to be able to share my journey in medicine with all of you. I know firsthand how daunting it can be to choose a medical specialty. And there are many factors to consider, including your passion, your lifestyle, long-term goals, and yes, even salary. So my goal today is to give you my honest firsthand look at nephrology or kidney medicine, why I chose it, why I find it rewarding, and what you should know as you carve out your own path in medicine. So first of all, I'm an island girl. I was born and raised in Kingston, Jamaica. I completed my medical school training in the Caribbean and then went on to complete my internal medicine residency at the University of Connecticut. I did an extra year as a chief resident and then pursued my fellowship training in nephrology. So to be very honest, nephrology wasn't even on my radar when I started medical school. I found the pathophysiology very complex and kind of shied away from it. Like many students, I initially gravitated towards the more well-known specialties like the heart with cardiology, critical care in the ICUs, or even psychiatry at one point. But it was really during my residency at University of Connecticut that I found myself drawn to those complex sodium cases that required deep thinking and problem solving. And that's what nephrology is. It's one of those specialties where nothing is ever straightforward. And the kidneys are involved in almost every system in the body that you can think of. Managing kidney diseases require understanding of fluid balance, electrolytes, acid-base disturbances, and even vascular access for dialysis patients. I love the challenge, and that's what really sealed the deal for me. What I learned during my fellowship training was it's really the patient interactions and the time I spend with patients that really appealed to me the most. These are the patients who are often dealing with chronic conditions, and I get to build long-term relationships with them. Some of my most rewarding moments have come from guiding them through their dialysis journey, helping them manage their disease, and sometimes even getting them to the point of where they get a transplant. So the continuity of care is something that I didn't know I needed, and I'm so glad I found. So the pathway to become a nephrologist is very similar to what you've heard before. You do med school, then you transition to residency. For me, it was internal medicine residency for 3 years, then followed by a 2-year fellowship. And there are opportunities to specialize further. beyond the 2 years of nephrology training. You can do transplant, you can do cancer-related kidney diseases, you can do inflammation of the kidneys or glomerulonephritis, or you can even do interventional or procedural nephrology. And then the types of jobs that you can get are in academia, in private practice, in industry as well. So there are several opportunities. You can skip forward to the next slide, as well as the next slide. Okay. And then every specialty has its ups and downs, and nephrology is really no different. The patient complexity is one of the aspects that tend to turn people away. Patients with kidney disease often have multiple coexisting conditions that require prolonged care, coordination, as well as frequent monitoring. I see my patients sometimes once a month. They tend to have complex medical, social, and even ethical issues that need to be addressed. And it often involves having very difficult conversations about things like dialysis initiation, end of life care, and limitations of treatments that we do have to offer. So personally, these conversations can become emotionally draining, but you learn how to set boundaries and you find interesting ways to decompress. So, and additionally, the training itself can be intense. You have heavy inpatient service time, call, long hours, and this continues even beyond fellowship into practice. So, but the pros include that it's intellectually stimulating. You never stop learning at any phase. You develop long-term, meaningful relationship with patients, and there's strong job security as the demand for nephrologists are on the rise. So, to end here, your career in the end should reflect your strengths, your interests, and the kind of life you want to build for yourself. Don't chase any specialty because of prestige or because someone says it's the best choice. Find something that excites you, challenges you, and ultimately makes you happy to go to work every day. Thank you.